Trigger finger. In trigger finger, the finger catches as it bends. The finger is straightened with a pop or a snap. The flexor tendon becomes thick and irritated as it slides through the tendon poly, causing a thickened nodule and triggering of the tendon. Discrepancy between the diameter of the tendon and the size of the poly, causing the triggering. Symptoms: pain located at the palm at the base of the finger. Tenderness at the A1 poly. It occurs more in women, more in diabetics, also in rheumatoid arthritis. It can be from repetitive injuries or occupational. Locking can occur when the tendon is unable to pass through the sheath. As the tendon becomes inflamed, it gets caught. Treatment: wrist splinting, injection into the sheath. Do not inject into the tendon. Injection can be repeated. Surgical release of A1 poly is the last resort. When you're releasing the A1 poly, the release should be done at the level of the MP joint. The A2, A4 polys are important. They should not be touched, excised, or released. Only A1 poly is cut and released, and the tendon is released. Technique for injections. Injection into the flexor tendon sheath may provide relief for triggering of the finger. The neurovascular bundle is on the side of the tendon and the poly. Go with the needle straight forward at 90 degrees to the tendon. After the site is marked, use a 25 gauge needle. Advance the needle through the midline down to bone. Pull the needle back slightly and inject the medication into the sheath or the poly freely. How do you release the A1 poly? Incision is made on the MP flexion crease. Here is a surgical case. The incision is marked in the palmar crease for the surgical division of the A1 poly. Notice that the correct fingers are marked before surgery. The A1 poly is exposed and released. You can see the tendon over the hemostat appear released. The patient is asked to move the fingers to confirm the success of the operation. How about trigger thumb? The incision for trigger thumb is placed in the MP flexion crease. When releasing the flexor pollicis longus tendon, watch out for the digital radial nerve. It will be in the field of your surgery. Ultrasound view. This is a sagittal view. The metacarpal is to the right, the proximal pharynx to the left. You can see the flexor tendon going through the A1 poly of the finger. This is a transverse view of the ultrasound showing the flexor tendon going through the A1 poly of the finger. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.